Can you state your name and your profession?
Brandi Roberson, nurse practitioner.
What made you decide to get into this field?
Um, I wanted to take care of people. Um, and also I wanted to take care of my mom and dad when they got older.
How did you prepare yourself to get into this field?
Ooh. In high school, I took a class called Health Occupations, and I got my CNA certification. Also got my CPR certification. Um, I guess that kind of laid the foundation for where I am now.
What was your schooling like?
Um, it was challenging. After my CNA certification, I went to school for my LPN. That was difficult, but I made it through. Then I went on to my registered nurse and now nurse practitioner. But out of all of them, I would say LPN was a little bit more challenging.
What's the biggest challenge you face while working in this field?
Accepting when people die.
What's your greatest strength while working in this field?
My greatest strength is I'm very compassionate, caring, and I listen.
What are some daily tasks that you complete?
Charting is one. I have to document what I've done for the day. I have to assess patients, listen to their heart rate and listen to their lungs, ask them how their day going, any concerns they may have for me. I check on labs that I may have ordered, any vital signs that staff may have taken, put in medication orders, and diagnose.
What kept you motivated while pursuing this field?
I would say my family.
What do you think are the most important skills for someone to have while working in this field?
Definitely you gotta be caring, you gotta be compassionate, you gotta care what happens to your patient. You also gotta listen to what they're telling you. Whatever symptoms they're having, you need to take it serious. So listening, compassionate, you gotta be caring.
What do you enjoy the most when working?
I work with the older adult population, so I enjoy the stories that they tell me, some stuff that they used to do when they were younger. Just making those connections with the family and the patients.
What career would you pursue if you didn't go into this one?
I think I would be a veterinarian because I love animals. I've been an animal lover since I was young. I can actually remember going down to my dad's house every summer to see what new puppies were born. He also had chickens and cows. So if I had to pursue another career, I think it would be to be a veterinarian. The second thing I probably would pursue would be being a dentist because I love getting my teeth cleaned. Weirdly to say, some people don't like getting their teeth cleaned, but I like teeth and I'm interested in teeth, so I think that would have been the second thing if I had to pursue something else.
Would you recommend this field for anyone looking to pursue it?
Yes, I would, because it is rewarding, but I must say it is challenging. At times it can be stressful. Sometimes you don't know what to do and you have to consult other providers in your practice just to see exactly what to do. But I would definitely recommend it to other people that are pursuing this. Yes.
Can you tell me 2 interesting stories that have happened while working in this field?
Sure. One story that I can think of, and I actually did a presentation on this in college, and I had an older gentleman. He was at end stage of dementia. He had had a stroke years prior. He did not eat on his own. He was not able to speak, so he had no verbalization. His hydration and his nutrition came from a peg tube. So he had a tube that was inserted in his stomach, and we would go in and pour water and nutrition down the tube. His wife would always come in and bring us, I would never forget, she brought us KFC all the time and donuts. She was really sweet. But one day she passed away. And when she passed away, the son and the daughter wanted to meet with the doctor because they said their father would never want that type of life for himself, just to be laying in a bed and getting his hydration and nutrition with a peg tube. So their wishes was for him to no longer get any hydration or nutrition in his peg tube. So basically that means we was gonna allow him to die. So the doctor went in and he wrote the order to stop hydration and nutrition through his peg tube until his life ended. That was very difficult for myself and some of the nurses. So we couldn't give him any water. We couldn't give him anything to eat. We had to just wait till he died. And technically we were following what the son and the daughter wanted, but this is not what the wife wanted. But they waited till she passed away to ask for this because they were the power of attorney for him. So usually it takes 7 to 10 days for your body to pass away with no hydration and nutrition. So it took him a little longer because I think some nurses were feeling compassionate and still giving him water and nutrition, but eventually he did pass. So that was very difficult for me to go through. So that was one story.
How did that impact your medical career?
Oh, it definitely made me value life more than I already had valued it. And it also inspired me to talk to my family members and make sure they have a living will in place. So in the event that you are not able to make decisions on your own, not able to verbalize what you want, have it in your will. Hey, I don't want a peg tube. I don't want an intubation in case I'm in a place where I can't make decisions on my own. So I definitely look at that differently because we don't know if that's something that he wanted because he couldn't communicate to us and tell us otherwise. Oh, you asked for 2 stories, didn't you? Let's see, another story I have was when I first started as an LPN, and I had a patient. She was actively talking to me that morning, and then around noon she just went where she just was very confused. She was talking about somebody was in a room. She was hallucinating. So she hadn't too long had surgery, abdominal surgery. So something told me to look under her dressing. And once I pulled the dressing open, blood was just pouring everywhere. I mean, on the floor. It's like she had an active bleed, which was so scary for me. And I just remember it because she almost died, but we sent her out and she made it. But that's one story that kind of impacted my life, just to make sure I always watch my patients carefully and notice those changes.
What colleges did you attend?
You want the colleges and the technical schools? Because I went to some technical schools too. All of them, all the above.
All of them.
I've been to GMC. I received my 2-year associate's degree. I went to Central Georgia Tech and received my diploma for my LPN. took a couple classes at Georgia College, but I didn't graduate from Georgia College. I went to Darton College, which was a bridge program with Sandersville Tech, and I also went to Chamberlain, which is an online college. I think that's about it.
And last, what advice do you have for someone who wants to get into this field?
I guess make sure this is something that you want to do. Make sure you have the right mindset. Make sure you know it's a serious job and you have people's lives in your hands. It's not taken lightly. It can be challenging but rewarding. As long as you put your mind to it, it can be accomplished.
Thank you for your time.